I forget one more. Nipple discharge. Yes, there was once a woman that came to our clinic, has no lumps, no swelling, no pain. But when I squeezed the nipple, after when screening her breast, I noticed that the nipple discharge is coming out is red. Mind you, she's not pregnant. I'm not talking about pregnant women or lactating mothers, those who are breastfeeding. I'm talking about a breast discharge that is reddish, like blood, like when you cut yourself and you're bleeding, or a brownish color, like our tea and coffee we drink. We all are familiar with that color. Or if it's like a mucus consistency, right, and it has odor, must be reported ASAP. So those are a couple of them. There are more, but these are main ones that we look out for, because if we notice that, then it should be reported.
I hope you're taking note because I am taking note of all of this. For our next question, how do you people test for breast cancer with different symptoms? Like you were saying, there was no swelling, no lumps, none of that, but you squeezed her breast and you noticed. Are there certain methods that you people use to test if someone has breast cancer?
Yes, obviously, like I mentioned, these are the signs that one should look out for. And where to start is being breast aware. Become aware of your breast. It's your body. It's only one body you have, right? Look at it, touch it. Again, there is a technique that you can do it. That is actually the correct way. And checking of the breast regularly should be conducted, like very regularly, until the rest of your life, basically.
Okay.
Which is called self breast exam. What I mean by that is you yourself can perform your breast exam. You do not necessarily need another person to do it. However, it's important to get a health professional personnel to do that for you, because they are more experienced and skilled and know what to look out for as to what is abnormal and what is normal, right? So the
Yeah.
breast self exam is very simple. Wherever I go, I try to make sure I teach every girl, especially young ladies, right? Because I believe there will come a world wherein no one will die of breast cancer. Because if you're able to detect cancer at its or breast cancer at its early stage, you're guarantee of saving your breast and your life, right? So how to do it? This breast self-exam can be performed in the comfort, or should I say privacy, of your home. But timing is so important for women who are childbearing age, as in those who see their menstrual period. The best time to check your breast is ideally 5 or 10 days after your period, right? So when it's past 10 days, that is great. Don't check your breast during period or a few days before your menstrual period, because it will not give the accurate findings. So what you do is stand in front of your mirror, okay, bare chest of course. You observe your breast, look out for the signs I mentioned: the shape, the size, the nipple, the skin color of your breast, right? You've checked. You can put your hands on your hips, you can put them over your head, to be able to observe even the under armpit, right? And so when checking your breast, what you do, I like to start with the right side first. You put your right hands over your head, use your left hands. Now this is important, right? You don't spread your fingers, you put them together. The 3 middle fingers, you feel it from the tip of your fingers to the base of your palms, right? This is where you should be, massaging your breast, right? So you start around the collarbone area, right? Because all this area is a breast area. They're all connected, right?
Okay.
You feel for what? Any lump or any thickness or any pain as you apply. Apply pressure. You go round your breast. Continue going round, applying more pressure until you feel behind your nipples, right? After feeling behind your nipples, you move now to the armpit, right? Bring your hands down a little bit. Feel for this same lump that I talk about, right? How does this lump feels like? A lot of people will ask. Well, they can come in various sizes, but they're round and hard, okay? That is how they feel like, round and hard, right? So after feeling your armpit, the last step is in between your thumb and your index finger. You squeeze your nipple, right? You do it 3 times to look out for any discharges. Now, mind you, there are some women who have a normal discharge, though they're not pregnant or breastfeeding, but it's the color that you should take note of, right? If it's bloody, if it's brownish, or it's mucus like, must be reported, because those are not a good signs. Now there are other ways, other methods of screening, right? For women 40 years and above, right, its best method is to use a mammogram, to go for a mammogram. So what is a mammography, right? Mammography is basically an x-ray specifically for the breast. And I tell you, it is so powerful in a sense that it will be able to detect any problems in the breast even before a lump is formed. That is what we call early stage and early detections, right? Because early detection saves lives.
Yeah.
For women who are childbearing age are not fit for a mammogram, unfortunately, but still there are other options. You can go in for an ultrasound of the breast, which your doctor can easily prescribe for you, and there's so many places here in Sierra Leone you can get them. As for the mammography, there are only limited places. Places like Ecomed and Choitrams are the places that are only offering these services. As for breast screening, breast checkup by a health professional should be done every 3 months ideally. Why 3 months? Because it can take us 3 months to develop a breast. It can take us this short time to start feeling for your breast to, move from a normal breast to a breast that has a problem, right? So it's so important to go for a regular checkup, okay, with a health professional. And at Thinking Pink Breast Cancer Foundation, located at 32 Pandema Road, we offer breast screening, and we also teach the individual how to check their breast because we believe in empowering them with such life-saving important exams.
Okay, that's amazing.
Thank you.
Something just dropped in my mind. I could remember a couple of years ago in Genesis 1, going to 2. It's the time we hit puberty and everyone is excited. Everyone, is really just so, oh my god, am I matured, have I reached puberty? And that we have this senior, and they are like the experienced ones. Yeah, we take them as they know it all, right? So one of the things that they usually did was to check if our breast was firm, if our breast was okay, or if we were matured enough to be pregnant and be able to breastfeed a child. And believe it or not, one of the things that they usually did was they'll feel your breast, and when they do feel your breast, I don't know how they did it, but they said they were looking for a seed. They said they were looking for a seed, and when they feel your breast, and they will be like, get seed yet, quote unquote, get seed yet, you're not matured enough. And if someone, they touch it and like, okay, you have seed. Yeah, so I'm trying to process this whole lump and connecting it with having seed in your breast.
Okay.
Like, is there a similarity, or were we just confused?
Okay, that's a very, very good question. Actually, the first time anyone has asked me such question.
Okay.
Right, I do hear it, like some mothers will say, my daughter, she's developing breast and it feels like she has a seed. And when me, a health professional, when I checked it, I noticed that it's just puberty, right? It's normal because there are difference between puberty seed or puberty gland to actual lump, right?
Okay.
And so I would advise that a lady or a young girl may go for a regular checkup, because with time it sort of like dissolves away, if I should put it that way. It sort of like goes away, you start developing breasts. But those what you feel are mainly like fatty tissues and glandules, right?
Okay.
They're just glands, like the ducts and the lobules and forming, basically, right?
Okay.
I believe so. So it's different to lumps. Again, it may be because there was one young girl, an interesting story, who developed these seeds in both breasts, but with time one disappeared but the other one stayed back, and continued developing breasts. This seed is still there, so she raised that concern, and when we checked and we got it examined, it is a lump actually.
Wow.
Yes. So, and that is why it's important to be observing it, observe the both breasts. One will go and one will stay. If both goes away, that is absolutely normal. But if one stays behind, that should be an alarm for you.
Okay.
Get it regularly checked to a healthcare professional, right? Because nowadays I see a lot of young girls, especially teenage girls, having these breast lumps at a higher rate than I've ever thought, or any other age group. Breast lumps among young girls, teenagers, it is so high than any other age group so far I've seen. Yes, based on our data that we collected.
Is there a reason for this, like why teenage girls are having more breast cancer?
Okay, I did not say breast cancer. I said breast lumps.
Breast lumps.
Ideally, so basically,
so when you have a breast lump, it
Yes.
does not really mean a breast cancer.
not exactly, because
Okay.
again, you see, one has to get that lump tested. Like I said, not all lumps are cancerous. However, there is breast benign, which is a non-cancerous lump, right? It
Okay.
will grow and it will cause a lot of discomfort in the breast, and it should be treated as soon as possible. And then there is a cancerous lump, right, which should be treated ASAP, because one thing about it, it doesn't stay one part, it moves to the other parts of the body. And when that happens, it becomes very difficult to treat, and most cases some people would become, like they'll pass off basically, because it has taken all over their body, and the cancer load would eventually slow down their body to the point that it kills them. So it is so important that one knows this difference, okay? However, the sad part is that if a lump is even a benign lump, the longer it stays in the breast, the chances of it turning into a cancerous breast cancer is very high. So it's so important to detect it and get rid of it ASAP, get it removed basically. Yeah.
Wow. Okay. So thank you so much for being here with us. We'd like to go for a very quick and short break, and we'll be looking at one of my favorites, castor oil. We'll be looking at some of the benefits of castor oil. Don't go anywhere, stay with us, as we'll be right back.
Castor oil is a versatile type of vegetable oil that has been around for hundreds of years. The oil is extracted from castor beans and actually has many different medicinal, pharmaceutical, and in a positive way. Be sure to watch until the end, because there's one that I think will surprise you. So, if you're ready, let's get into it. Just a quick reminder, we are not doctors. This video is for informational purposes only, as a deep facial cleanser. Research has shown that castor oil is useful for removing makeup, reducing acne, and soothing sensitive skin. It is also much friendlier for cleansing your skin compared to some of the common types of soap that many of us use. Castor oil is known for having antibacterial properties. However, unlike some of the soaps and detergents sold in stores, it doesn't strip the top layer of your skin of its good bacteria, which is actually good when it comes to preventing acne. Another benefit of castor oil is that it can reduce wrinkles. Research has shown that castor oil has anti-inflammatory properties and antioxidants that can combat free radicals and protect your skin from aging. Castor oil also contains ricinoleic acid, which is a monounsaturated fatty acid that serves as a natural moisturizer, which of course is good when it comes to reducing wrinkles over time. Not only can it reduce wrinkles, it is effective in reducing stretch marks as well. Stretch marks are actually a type of scar that occurs after your skin becomes stretched in a short period of time. When this occurs, the collagen in your skin breaks and the healing process leaves behind these marks. With that said, research has shown that massaging castor oil into stretch marks causes the scar tissue to flatten and become softer. This provides deep moisturization and helps them go away over time. One thing to keep in mind is that this technique works best if the marks are less than 2 years old. Another benefit that we should mention is that castor oil can promote hair growth. Castor oil contains fats and other properties that can promote a healthy scalp and treat dry and damaged hair. It works by lubricating and moisturizing the hair shaft, which promotes hair growth and decreases the chances of breakage. Studies found that it is also effective in treating dandruff, which is an inflammatory scalp condition that causes flaking. Simply applying castor oil to your scalp twice a week can result in thicker, shinier, and stronger hair over time. Castor oil is also believed to be an effective remedy for arthritis. Arthritis is a painful condition caused by inflammation in your joints. So it only seems natural that the anti-inflammatory properties of castor oil can help alleviate these unwanted symptoms. It can be used as a massage oil applied directly to your joints and muscles to alleviate pain. It is also believed to be effective when taken orally as well. So you can consider adding it to your tea with a pinch of ginger for maximum results. I mentioned this earlier, but castor oil can also serve as an effective treatment for acne. Acne is a skin condition that occurs when follicles are clogged with oils and dead skin cells. It is often caused by inflammation, which explains why castor oil is an effective treatment thanks to its anti-inflammatory properties. Not to mention, castor oil has antimicrobial properties which can help fight off the certain types of bacteria on your skin that causes acne. It can be applied daily to treat acne that is already present. Or if you want to prevent new acne from occurring, you can apply castor oil a few times per week. Another medicinal benefit of castor oil is that it can boost the immune system. Some researchers believe that castor oil can increase your white blood cell count, which increases your body's ability to fight off infections. To be more specific, it is believed that castor oil increases lymphocyte production. Lymphocytes are a type of white blood cell that produces antibodies whenever an infection is present. So by increasing the amount of lymphocytes, it strengthens the immune response, which helps eliminate invading viruses, toxins, and bacteria. Moving right along, if you're having trouble sleeping, you're going to like this next benefit, because castor oil may potentially provide relief for insomnia. Insomnia is a sleep disorder in which it becomes difficult to fall asleep. If you've been experiencing this, just know that castor oil can help. More research is needed in this area, but some people have had good results when rubbing a small amount of castor oil on their eyelids before bed. The absorption promotes relaxation, which can help you fall asleep much faster. Another common medicinal use of castor oil is to relieve constipation. It contains properties that act as a natural laxative in our small intestine. This explains why researchers often promote castor oil as a natural way to relieve constipation. However, while castor oil is often considered to be safe in small doses, consuming too much can lead to unwanted side effects. So just to be safe, it's always best to speak with your doctor first before using. Another surprising use of castor oil is as a treatment for ringworm. Ringworm is a circular and often itchy rash caused by a fungal infection. There aren't actually any worms involved in this rash. It gets its name due to its circular appearance. The good news is, castor oil has antifungal properties that can be effective when it comes to fighting off the fungi that cause a ringworm infection. So just to give a quick recap, the top 10 uses of castor oil that you must remember include: it can be used as a deep facial cleanser, to reduce wrinkles, to reduce stretch marks, promote hair growth, as a remedy for arthritis, as a treatment for acne, to boost the immune system, relieve insomnia, relieve constipation, and as a treatment for ringworm. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well, because we have a ton of other videos on our channel that I think you will enjoy. Millions of people around the world are looking to take advantage of the health benefits that come from using castor oil. Hopefully the information that you learned in this video can help you do just that. With that said, keep in mind that we are not doctors and this video should not be taken as medical advice. Again, this video is for informational purposes only. But hopefully you learned a thing or two, and hopefully you're now one step closer to improving your overall health and thus improving the overall quality of your life. If so, be sure to let us know down in the comment section below. And if you want to learn even more about this topic, we do have a full guide on our website. I'll drop a link to it right below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.
and welcome back. If you're just joining us, this is a wellness program that comes up every Wednesdays 4 to 5 p.m. And for today, we're looking at breast cancer so far. So let's have a quick recap before we go any further. So we've learned that breast cancer does not only happen to women. In rare chances, it also happens to men, and it doesn't matter if you have flat chest or bigger boobs. Yes, there's a possibility for having cancer, except that having bigger boobs increases your chances of having cancer. And then we also learned some of the ways of knowing if you have cancer. There is lumps, there's if you're discharging, and then if you notice there's abnormal swelling, and if your skin color, your breast skin color changes, and if you should check under your armpit for lumps. I just realized that some people have rashes, and there are kind of some complications under the armpit area. I don't even know if that's that's also countable for rashes. And
Well, like I mentioned earlier, there's different other diseases or condition that affects the breast. However, most of them have the similar symptoms to breast cancer. Reason, like, there are other breast conditions that causes breast swelling, breast pain, nipple discharge, different discolorations. So some of these are having similar signs and symptoms, so it's so important to report them, especially that it just these signs symptoms carry on for more than a week. So important, very important.
Okay. So if you're just joining in and you have a question, contribution, or a story about a certain experience you'd like to share with us, like I did with my JSS1 story, you can call or drop a text message on 079-716-255. That's 079-716-255, or 079-920-500. That's 079-920-500. So without wasting time, we are going to continue with this discussion. It is very, very interesting. Actually, I have learned a lot. So with regards to breast cancer, what are some of the ways to prevent it? What are some of the ways to prevent having breast cancer? They can usually say prevention is better than cure. What do you do to prevent it?
Okay, so it's very interesting that there are ways to help put you in a better position not to sort of like be diagnosed or get breast cancer. However, it's quite difficult, but there's still something one can do. If we can start with your diet, right?
Okay.
What you eat is what you are. So basically, you eat mainly plant-based food, more of vegetables and fruit, organic type to be specific. You stand a better chance of equipping your body to able, defend itself of such, a disease. And also exercising regularly, not just once in a month. Not ideal. So one will think that, okay, I do my house chores every day, I walk. Well, that is just basically not enough. You need to really physically exert a lot of energy, and not only that, you need to move each and every muscles in your body. It's really important.
Wow.
Another one is obesity, right? You should try and maintain an ideal weight, right? So like exercising is one way, eating healthy is another way to maintain an ideal weight. And other way to prevent it is to curbing your stress, right? This is one thing a lot of people don't mention it, but a lot of stress does contribute to the release of certain hormones in your body, which sort of like prevents your body from functioning normal way in normal circumstance, right? And so like it puts you on a flight and fight mood, right? Like you see a danger, your body sort of like releases these hormones to prepare you to run for your life or fight whatever is trying to attack you, right? So a lot of functions have kind of like stopped or withheld, but chronic stress is what actually does put one at risk of getting cancer. So manage it by meditating, trying relaxing, going to nature, or basically, praying to God, so that God will guide you, and having faith and hope. Another ways to prevent it is to go in for regular checkups or know your family history, right? Ones who have a family history, like who had aunties, uncles, mothers, brothers, sisters who had cancer, are basically what we call known risk, right? Maybe that it's hereditary, so it's important to visit back grandparents, great grandparents era and know what other diseases are there. And if cancer isn't part of it, one should go for regular screening and engage in healthier lifestyle. Because there's something which we call doormat gene, like, right? Cancer has a specific gene. For breast cancer is BRCA1 and BRCA2, right? And they're mainly dormant until you expose yourself to contributing risk factors. That is when one gets cancer. You notice that some people would smoke for 20-50 years and they don't get cancer. It's dormant gene of cancer, but because you started something that triggers it, that's what may bring about it. And other ways to prevent it is to stop smoking tobacco, cigarettes, to stop smoking tobacco, cigarettes in any form, in chewing form, in snuffing form, even in a form of shisha. One should avoid it. And not only you, the individual smoker that's not smoking but is inhaling all the toxins that this smoker is releasing, right? Okay. Also avoid consuming alcohol or reduce or have a restriction on it, right? Excessive alcohol consumption does put one at risk of getting cancer. Avoiding it is the best options, right? And other ways is also avoiding environmental risk factors, right? What I mean by that, so basically what I'm trying to say is that 1/3 of cancer is due to our environment you found yourself, right? So basically, like one's staying in a highly industrialized area, like factories releasing smoke, releasing waste to this ground or the water that we drink. That is one options, or exposing yourself to carcinogens, right? What I mean by that is like these are chemicals or substance that causes cancer, right? So what are they? So basically like burning of bush or burning of trash. You can imagine if you burn one plastic rubber and it releases all this dark toxic smoke, and if you inhale it, your body automatically recognizes that is a toxic and helps you to release that by coughing and spitting or whatnot. And imagine having a whole dumpster with all sorts of waste and dirts being burned and the toxins released into the air that we breathe in. We are actually at risk. The car escorts, the black smoke that the car releases, or a bike or a truck, those are also dangerous carcinogens, right? And there are plenty more, but I don't want to get through that because we will never be able to finish. But those are the main ways to help prevent. I forgot to mention, perform your breast self-exams and go for regular checkup, because that is the number one best way. Unfortunately, we're in the world because of this generations, the industrialization and whatnot of everything, and the radiation list I mentioned. Exposure to radiation could put one at risk, so it's important to protect yourself from it, right? Okay. So like I was saying, the way the lifestyle is right now, everybody's eating fast food, no one is exercising, a lot of people are at risk. If not, we're all at risk of cancer. So it's best to go for regular checkup, because checking up is one best way to be able to detect any sort of abnormalities in your breast early. And once you catch that early, chances of cure and long life is very possible.
I think that's my next question. Okay. If it's not treated properly and let's say on times of survival, what are the chances of this person surviving this breast cancer?
Okay, so the sad reality is that cancer is an expensive, the treatment of cancer is very expensive. And so here in Sierra Leone, especially in the area of cancer treatment facilities, we have so much limitation in, right? So basically, if I can give you guys a picture of how the treatment option is first a surgery is performed. The patient undergoes operation to remove the cancer or the tumor or the lump, like what most understand it to be. And then second step is to take the chemotherapy, which is basically a cancer drug that is being taken into the body to help kill further cancer cells, right? And the lastly is radiotherapy, right? And radiotherapy is sort of like an X-ray machine, but it is 50 times stronger than an extra machine. It's meant to kill the cancer cells, which the doctor could not see and remove during surgeries, basically. So unfortunately, we do not have radiotherapy in this country. So if we only offer chemotherapy and surgeries, thankfully, but there are other more treatments that also come into play, other more diagnostic methods that come into play that helps with the management. But again, it's because most of the time, especially most of my patients, is due to financial constraints. They're not able to even pay for like a surgery, let alone chemotherapy, which for one cycle it costs more than $100, and not many people can afford that, especially women. You can imagine a market woman selling pepper is diagnosed of cancer. This is true life story, yes, and they don't have any amount of money to even pay for consultation, let alone registration. So Thinking Pink Breast Cancer Foundation does normally come in to help fundraise for these individuals and help them with the treatment options, right? So it's sadly that we say that if one is diagnosed of cancer, a treatment as soon as possible is needed. If not, there are risk of it spreading, because cancer, there's 4 stages. Stage 1 and stage 2 is when the cancer is limited in one part of the body, and it's very, very treatable and curable. But once it gets to stage 3, it started spreading. Stage 4, it has spread to all parts of the body. You can imagine, like, if a lump is found in the breast, a breast is removed, right? Through operation, a mastectomy is called. But if it's cancer is found in the lungs, that is, if you did not get treatment sooner when the cancer was still in the breast, then it spreads to the lungs. You cannot really perform surgery to remove the lungs. Does that make sense? Because the individual will equally die. So you see how very hard it is when cancer starts spreading to other parts like liver, your spine, your bones. It's very difficult to treat, because then you have to think about removing that part of the body, and when that is removed, the quality of life is drastically reduced, and that would most times lead to death of a lot of women and men too. So it's so important that you get a treatment ASAP, and it's so important for my viewers and listeners out there to support the foundation called Thinking Pink Breast Cancer Foundation, and many more that are helping these cancer patients to get their treatment as soon as possible. Because one thing about cancer doesn't wait on anything or anyone. Any day, any weeks, or any months pass by, it spreads. It starts spreading to other parts, because that's what it does. Cancer, it spreads and destroys other parts of the body. It doesn't stay in one place as like benign lump. So that is the case, unfortunately.
Okay, so one of the methods that you mentioned was having to go through operation, and I can just imagine that having to go through operation means removing your breast, right?
Yes.
Yeah, so for women that go through the operation, let's say they do get pregnant and they give birth, are there like suitable methods for them to alternately breastfeed these children, or do they have to find another woman to breastfeed their children?
Okay, so in the area of breast cancer, when a breast is limited in a lump, right, that is, it hasn't taken over the breast as its stages progress. Like stage 2, 3, it starts spreading. But stage 1, and that is early detections. Like I mentioned, early detection saves lives. And a lot of cases when a lump is limited, cancer is limited in the breast, only the lump and few tissues is removed. That means a woman can still breastfeed, you know, in the near future, right?
Yeah.
As compared to if a breast cancer has spread to other parts of the breast, you know, like as taking over the breast. Unfortunately, the options left in order to save the woman's life from, you know, breast cancer spreading to other parts of the body is to remove the breast, just so it doesn't further spread. And so if there's no breast, there's no feeding on that breast, unfortunately, right? So the next option is either use a formula or to get another wet nurse or mother to breastfeed a child. Yes, but again, once a breast has a breast cancer, that breast is basically like you cannot breastfeed there, and basically you cannot even be pregnant with the breast cancer, because what happened is that the cancer would further progress. And a lot of cases that I have witnessed here in Sierra Leone, a lot of women lose their babies, you know, or their infants at the very early stage in pregnancies because of the cancer load in the body, unfortunately. Yes.
Okay. So, as a nurse, what are some of the reactions that you've seen with people with breast cancer? Especially, I can imagine teenagers going through all that stress, and I'm very sure most of them, if not all, or some of them, let me just say some of them, is a possibility that they will go through depression and stuff like that. All the stress and the worry and the anxiety, the fear.
Yes.
Yes, I can imagine.
Wow.
So how do you as a nurse have to deal with all this patient? I can imagine dealing with teenagers.
Okay.
Yes, dealing with their emotions and all of this combined together with having to help them go through this stage.
Yes. So, wow, when a patient first detects a lump or breast abnormalities, she gets scared because, you know, the information is out there, breast cancer is out there. She could be thinking, do I have breast cancer? Could I have breast cancer? You know? So they go through a lot of stages of grief, denial, anger, withdrawal, depressions, and eventually they will come to accept it that, okay, now we have breast cancer. Now what do we do next, you know? But sometimes it's delay that causes the danger, right? Because like when you're in denial, you're like, oh, I cannot do, and I don't believe I have breast cancer. I don't think there's breast cancer in my breast. Whereas breast was in its early stage, and that is when it's best to get a treatment, all right? So they go through this, and obviously, like I said, depression is another one, right? And I'm not only dealing with the patient themselves, I'm dealing with their families. You can imagine their spouses, their daughters, their sons, they're also dealing with their own depressions and grieving, right? And so it's very important that a nurse, and not only a nurse's job to help them cope, provide a coping mechanism, but also have a round of other healthcare professionals, the doctors, pharmacists, and whatnot, to come in board, especially a social worker or other psychologists, to come in to help these families try and find the best way to cope and find a coping mechanism for them. It's a very stressful thing, but time is the best healer, like I said. And most of the times, I even invite like pastors or imams to come on board and help guide these patients, you know, to help strengthen their faith, you know, because faith is one thing that I see pull a lot of women and men out of their depressed circumstance. Yes.
Okay, so thank you very much. So do you have any last word out there for a woman or a girl watching this program right
Be
now?
breast aware. Check your
Okay.
breasts. Come down to 32 Panema Road, Thinking Pink Breast Cancer Foundation, and get your breast checked. As we know, breast cancer is real and is affecting so many, but early detections will definitely save your life. Come down to Thinking Pink Breast Cancer Foundation and get your breast checked. Thank you very much.
Okay, wow, it's such a wonderful time, and I'm so glad I had you here with me. And this brings us to the end of today's program. Thank you very much for staying here with us. Thank you. Don't forget, this program happens every Wednesday from 4 p.m. to 5 p.m. on Redeemer Media Network, channel 25. And of course, if you missed it, you can watch on our YouTube page, that is Redeemer Media. So before we go, I'll just like to say this quote from Christina Abigail. Says, when you get diagnosed with cancer, there's such a sense of loneliness. But what you need to know as people going through this is that you're not alone. Yes, you're not alone. Okay, so thank you so much for staying here with us. Till next time, I am Shirley Williams. Thank you.
Thank you very much. Wow, Madam Camera Woman.